Now, let me share with you what panic can do. Panic will make you wear hand gloves around the street when you're not a doctor or a nurse attending to a patient. The danger in this, as the Minister of Health has pointed out, is that you will be collecting all sorts of germs and perhaps virus, and in turn pass this on to as many people as you come in contact with. On the part of healthcare providers, panic will mean declining to treat a patient just because he or she has fever or is vomiting. The danger in this is that many who need treatment for malaria or typhoid may be lost to these illnesses because of rejection or lack of medical care. The important thing for everyone to know and act upon is that regular and proper hand washing with soap and water is important for both the young and old, not just at this period, but as a matter of imbibed personal hygiene. Also remember, and this is especially for healthcare practitioners, every fever is not indicative of Ebola virus disease. While a high index of suspicion is expected and suspected cases reported to health authorities, others in need of treatment for fever-like sickness should not be denied. As a health worker, observing the highest level of infection control through barrier nursing must be your #1 rule. We all need to stay safe. Okay, we still have some time to bring you up to speed with other news from the health world. A panel of experts convened by the World Health Organization in Switzerland has reached the consensus that in the circumstances of the Ebola virus disease outbreak, it is ethical to offer unproven interventions with as yet unknown efficacy and adverse effects as potential treatment or prevention. The panel had considered and assessed the ethical implications for clinical decision-making of the potential use of unregistered interventions. The WHO said it was ethical in the light of the scale of the outbreak and high number of deaths. Over 1,000 people have died in West Africa. The World Health Body warned that although there were very limited supplies of potential treatments, where experimental treatments are used, there must be informed consent and the results of the treatment collected and shared. The organization considered that there were still many questions to be answered, including how data could be gathered effectively while the focus remained on providing good medical care. The move came as Liberia said it was getting an experimental drug, Zimap, after a request to the U.S. government. Moving on now, a national trauma center with 80 beds has been commissioned in Abuja for severely injured patients. The hospital has the capacity to handle all forms of trauma, ranging from falls, fire, accidents, and victims of natural or man-made disasters. Trauma centers are critical components of a nation's healthcare delivery system, providing resources and equipment to deliver the full range of specialist care needed by injured patients, and also maintain coordination with other facilities where the need for complementary expertise may be indicated. And finally, in a bid to curb the spread of unverified claims by manufacturers of both orthodox and herbal medicines and other NAFDAC-regulated products, the National Agency for Food and Drug Administration and Control has introduced NAFDAC advertisement approval guidelines. At a sensitization forum by the agency in Lagos for advertising executives from media organizations, the management of NAFDAC expressed its worries over the proliferation of advertisements, especially of herbal products, with misleading and false claims of treatment and cure of various ailments.
When you're talking about herbal products, for now, we don't have cures. in the category of herbal. Those products are what we call listed, where they're deemed safe for use. And so you can register a product, you can get a number. Now, if you want to advertise, you need to bring that material. We will look and see if, one, the category of product can advertise, the medium through which you can advertise, because we have prescription medicines, we have over-the-counter medicines. In those categories, we also have the foods and drugs. So the media are different. The message is different. If you have medicines that are prescription, you cannot advertise to consumers. You advertise to medical health practitioners, so to speak. So your target audience is different. So we have to make sure that the messages are specific, are in the right medium, and the content of the message is accurate and it's not misleading.
That's a wrap on the show for this week. I'm looking forward to seeing you next week. From me and those behind the camera, thank you for watching Health News. I am Yomi Otaigbe.